Hello, my name is Makini Fortino. I am the CEO of Deconstructing the Mental Health System, otherwise known as DMHS. And obviously, I am also expecting. My husband Brandon and I are expecting our first child next month. So I am excited to film this, but also be filming this as we emerge the 4th anniversary. We founded Deconstructing the Mental Health System with the mission of cutting the red tape for access to care, but more importantly, educating and addressing racism in the mental health system in and of itself. Over the years, the goal has and mission has evolved, but not strayed far from addressing racism in mental health. Let's go ahead and hop over to our website. I will give you a site tour and then do a brief recap. As I mentioned, our organization is really focused on being anti-racist and also educating others on anti-racist practices in order to address inadequacies and inequities within the mental health field that largely impact communities of color. When you go to the main site, which is dmhsus.org, the site is easy to navigate in a couple of ways. We have this top navigation section here that has a few different drop downs, which I'll show you in just a little bit. I'll highlight a few of those. And then if you scroll down, you also have a number of options of access here. When you go to the site, on the left-hand side, you'll see an icon of a person with a blue background. And when you click on that, you can, it's an accessibility feature to basically make sure that the website is easier to navigate visually for those who are needing either larger font or a different background color, different text size, etc. And at the very bottom of the site, there's a purple translate button, and it offers over 86 languages that you can view the site in. We're really excited about our accomplishment of getting very close to over 400 listings of providers who identify as Black, Indigenous, or person of color, or providers of the global majority. And what we're most excited about is that it expands the options for our communities of color to be able to more easily search for providers that come from a similar background or share the same language or a similar identity. Studies have shown that clients are seeking providers who can either relate to them, culturally relate to them, and or understand their culture to some extent, and share a similar background. And even more interestingly than that, providers also seek clients who share similar backgrounds. So we're happy to be able to contribute to making it easier for people to find services that are more likely to result in success in mental health services and mental health outcomes for those clients, and also reduce the barrier of having to search through listings of providers that they might not feel like would understand them or relate to them. This the visual display that we chose makes it easier for people to find the provider that they're looking for. We're also excited to say that almost all 50 states are represented. And in fact, we also have some providers from Canada listed as well. We're really excited to announce that we reached 400 listings this year. That means there have been 100 new individual listings that went into our directory, which increases and expands options for clients of color who are seeking services from providers who are less likely to cause racial trauma and more likely to relate to their experiences. We're also going to highlight the organizations we like page. We have about 76 organizations listed. These organizations were all founded by and or are currently operated by communities of color, founders of color. These organizations have a number of services. We have a Black physicians directory. We have a doula directory. There are a number of additional mental health and wellness services listed there as well. And we showed the resources for community page, as well as the resources for providers page. So we'll go ahead and go on to community events and offerings. The really cool thing about this, now this is not the DMHS in-house offerings, it can include some, but going off of some of the organizations that we listed and organizations we like, we also do follow these organizations on social media. We are connected with some of the founders and leaders within these organizations. So whenever they post opportunities or options for virtual spaces or free opportunities or free resources, we make sure to advertise those to get the word out a little bit further. Here are some highlighted organizations that we have been lucky enough to partner with and work with in different capacities. And now, instead of just the logos, you can sort of check out the kinds of partnerships that we have, the kinds of work that we've done with our community partners. And I will be happy to, in the next few moments, start talking about, because it's a great transition, into some of those partnerships. The first highlight that I really want to talk about is a community conversation that we were able to be part of. We partnered with Family First Community Center, HealthPoint, the Seattle Seahawks, and Nelson Middle School to make this happen. After generating some ideas and getting some feedback from community members, we talked about bullying. We talked about parenting in the 21st century, where phones are accessible and help with parenting as well. We also had conversations about what it was like for our panelists to learn about and get more involved in mental health over the years. And everyone was really vulnerable in the conversation as well, which we really appreciated. The panel consisted of Boye Mafe, a Seattle Seahawks linebacker, Roy Fisher of Efficient Counseling, as well as Rainer Scholars and the NFL Total Wellness team of clinicians, and Ryan Varian, a behavioral health consultant with HealthPoint. And I was very honored to be selected as the host of the panel and ask these brilliant minds sort of pick their brains around mental health and what mental health looks like in today's education system as well. We also broke out into two different groups. So there was a sort of parent group where we were able to have the conversation with just the parents. And then there was the youth group, give the youth who attended the opportunity to speak a little bit more about what their experience is in school while trying to navigate their own mental health. So last year we had about half of the providers that we have now. We're up by about 28 providers in our free therapy and wellness program. And I think one thing that we can attribute to our success of not just growth, but the retention of our providers, because many of our providers have been working with us since 2022, is the fact that we work collaboratively with them, that we make sure that we're matching clients with their services and their specialties, as well as their identities. And we pay them adequately. When we do have funding, we make sure that our providers are paid above the average market rate. And so, um, the coolest thing about that is when we do have funding, when we are able to operate services, clients have more options for providers that they can connect with. And providers have been gracious enough to hold anywhere from 1 to 5, sometimes 8 spaces for referrals, which is just amazing. And we have so much gratitude and we have so much gratitude to the providers for making space and availability for our clients. And we have received some really great feedback. Chose to highlight this particular set of feedback that we received this year to get to the root of what we are trying to do with our organization. We are intentionally aware with every initiative that we have that there are disparities having to do with the cost of services, having to do with how Black and Brown bodies are treated when we attempt to engage in mental health services, and to cut the red tape of insurance because not everybody qualifies for insurance or can afford it. And through our services, since we provide 12 free sessions, we're giving the opportunity for people who might have been looking for years for a mental health or wellness provider to finally be able to experience that healing. We also are ensuring that the services that are provided are high quality. And we do that by checking in at least before session 12 to make sure that people are receiving the services that they're actually seeking. As I mentioned, we do have some in-house workshops that we sponsor through some of the providers in our directory or in our free therapy and wellness program. I'm going to highlight a few of those. So a couple that were done this year. The first one is Money 101, and this was done by Nafasi Farrell of Narratives Unbound. And Nafasi offered actually a couple of options for people to attend this workshop free to the public to talk a little bit about financial trauma. Um, there is a lot of financial trauma in our communities of color for a number of reasons. We have experienced so many economic barriers to the extent that many of us believe that we can't attain financial sustainability and that we cannot grow economically. So Nafasi goes over the history and the impact of that as well, but also gives a pathway for people to change the relationship that they have with money. She did a fantastic job. Highly recommend checking out Narratives Unbound and a lot of the other work that she's involved in, educating the community around the relationship with money. And then we also had the lovely Erica Cherry, who is a licensed mental health counselor from Awaken Wellness PLLC, provide a couple of workshops on rediscovering oneself and finding empowerment. This workshop or these workshops were specifically for women of color. So it was a good space, a safe space for women of color to kind of work through some of their vulnerabilities together in a cohort, and then empower each other and empower themselves as well. We also had year 2 of PLLC Cohort, and I did do some storytelling last year, but to do a recap, PLLC Cohort was born out of the so many stories of providers who were trying to figure out how to open their private practice and didn't have a comprehensive way of pulling together information, having a series of steps to work through, and just kind of checking off those steps and that process in order to open their private practices. And I can actually say that is personally my story as well. Once I got my hours towards licensure and I had my license, I was like, well, now what? And what I did was I reached out to community members and on social media, and I said, how did you open your practice? And there were so many different answers and so many different ways to open the practice, so many ways to get it wrong as well. And I will say over the years, I've had to, and this is a message for anybody actually thinking about starting their private practice. It's okay to start and then go back and correct some of the things to get it right over time. But PLLC Cohort exists to prevent that story from happening and to help our providers of color um, who are wanting to take that next step in their career, open their practice with more ease and with a cohort. And so this training was called Legal Requirements and Cultural Considerations of Forming a PLLC. The CEUs, or continuing education credits, were sponsored by WMHCA, or Washington Mental Health Counselors Association. Thank you so much for sponsoring so many of the workshops that we've done over the past 2 years, but especially this one. And then we're really excited as well to announce that PLLC Scholarship had its second year, and we were able to offer 3 of our attendees from the cohort of 2024 the opportunity to work with Mercer Law PLLC, who helped these providers launch their private practices by working on all of the legal requirements to get them started. And so we met over a course of 5 weeks, and it was really, I would say, beautiful, heartwarming, nerve-wracking, listening to our cohort sort of talk about their experience of thinking about, contemplating launching their private practices, but sort of pulling back for the same reasons that I did so many years ago, which was, what if I get it wrong? What if I actually can't get that many clients? How do I advertise? How do I market myself? What should my website look like? And those are all of the things that we went over in PLLC Cohort. And it was hosted by Taquisha Dean, who actually hosted it last year, as well as Brittany Tillman, who is an alumna of PLLC Cohort 2023. So it was really exciting to see both of these beautiful, strong women return in different capacities and provide this workshop to our cohort. Also really excited to say that we put out a survey to kind of check in with our 2023 attendees, and 83% of our attendees from 2023 launched their private practice. Almost 50% of them maintain a client caseload of 10 to 20 clients. So while our cohorts are small, the impact is huge, because I want you to think about it for a moment. We have the free therapy and wellness program, which is well and good, but isn't always funded, isn't always available to all of our communities. So we help our providers launch their private practices and open up an additional 10 to 20 spaces. And 83% of those who attend are likely to launch their private practice and open it to that many clients. The impact of this is potentially huge. So we're going to continue to track it over the years, but I just wanted to share that so far it is a great success. Most people who attend our cohort do launch their private practices, and communities of color then have more options for clinicians that share the same cultural background as them and have availability. We also did year 2 of Become a Washington State Approved Supervisor. And we were super excited to re-partner with Kim McBride, Dr. McBride, from Envision Counseling, who provided a significantly reduced cost training this year, which was we covered that, but it was free to all of our attendees. And in the last minute, we were able to also connect with doctoral candidate Phoebe from 253 Therapy and Consult. She is the CEO of 253 Therapy and Consult, one of our partners going back to 2022 at the launch of our free therapy and wellness practice, to co-host this event with Dr. Kim. And it was just such an amazing thing to witness. So just as a recap, become an approved supervisor in Washington State is a training to help clinicians who have been fully licensed for at least 2 years get at least 15 hours, including 3 ethics hours. These are continuing education credits, but also hours towards being able to qualify as an approved supervisor in Washington State, which is huge. Let me just say, I'll just kind of pause this explanation really quick and say that one of the justifications for having a training like this, specifically for therapists of color, actually, there's 2 reasons. One is to help these therapists expand their practices and diversify their income, which helps maintain retention because many of them also maintain caseloads and are able to see clients. But more importantly than that, going back to the PLLC cohort, a lot of people who attended PLLC cohort are associate therapists. We do have some fully licensed, but most people who attend tend to be associate therapists, which means that they're working towards becoming fully licensed. And we want to give them the opportunity to work with fully licensed clinicians who have the hours to be approved supervisors. So it kind of interacts with itself in a way that more approved supervisors become available as more associate level therapists open their practice. We have the retention of clinicians of color overall, which increases access for our communities of color. So do you see how it's all connected? I love how it's connected. The other piece that I want to mention too is that there have been some studies that have shown that when providers of color are working on receiving their hours, they're being supervised, they're receiving clinical supervision from somebody who does not share their identity, who does not understand their background, who does not understand their culture, they are less likely to disclose important information about their sessions that could lead to good supervision, that can lead to the improvement of their work overall, which can cause harm to clients. Conversely, when clinicians, specifically clinicians of color, are supervised by people who do share their background or understand their background or share their culture, they are more likely to disclose information about their sessions that can lead to good supervision. So this is also very much a form of mental health advocacy to protect the client by making sure that the supervisee is disclosing as much information as possible in their supervision, feeling safe, feeling like they can grow, feeling like they can be vulnerable, so that they can then, once they receive all their hours, supervise themselves. The goal is always to not only increase access to mental health care, but increase the quality of health care and mental health care that our clients are seeking and very much needing, which reduces the likelihood for racial trauma overall. So this is feedback that we received through trainings that I mentioned earlier that were for community, as well as trainings for our professionals for professional development. I also want to share that we were able to grow our team this year. A strong group of wonderful women doing different things for our organization. Really excited to continue to be able to grow this organization and also make sure that voices of community are part of those who are helping in the background as well. Now, at the end of the 2023 report, I did mention that we would be receiving a few grants or a couple of grants, but I didn't want to disclose which ones there were until everything was finalized. But I'm really excited to say that we got 2 grants this year. The first one was through University of Washington. So we partnered with University of Washington CoLab and Care Team, and CoLab is within University of Washington, really focused on improving services for youth and families of color. And our partnership with them is to create a workshop and a training called Culturally Responsive Care, specifically for community mental health sites across Washington State. We'll be piloting at 4 different sites, offering a 3-day training led by Black clinicians who have both lived experience and they are both licensed in their work, and so can provide that evidence-based information from a cultural perspective for the community mental health sites that are selected, in hopes of improving services that are delivered to youth and families of color. Very exciting partnership. And the second grant that we received was the King County Public Health Gathering Collaborative. And this one actually, the background of this goes back to 2020. So there was the COVID crisis, but there was also social and civil unrest due to witnessing very traumatic police brutality and other kinds of brutality in 2020. Which led to this collaborative sort of talking about how do we address this? How do we address the mental health impact of these experiences? And we were one of the organizations really excited to say selected. And what we did with those funds is the Gathering Collaborative helped fund our free mental health and wellness services. So we were able to serve a number of community members by providing the 12 free sessions, specifically for King County community members who identified as Black, Indigenous, and Pacific Islander. And our newest partnerships that we're able to talk about, the first one is Renton Technical College. So we are partnering with Renton Technical College to provide 2 workshops, 2 different kinds of workshops, as well as free mental health and wellness services as a supplement to Renton Technical College's behavioral health department. Our other partner is the Black Community Equity Team with King County Public Health, and we now have an extension to our directory called Partner Affiliation. And so with the Black Community Equity Team, they have the Black Provider Network. So Black providers who are members of this team, when they create their directory, can now check a box that says Partner Affiliation, King County Public Health Black Provider Network, which helps community members in King County who are seeking mental health services find providers within this network. So this is a really exciting partnership that we're excited to see grow over the next few years as well. Now, this is the point of the annual report where I usually spend an additional 30 minutes going over all of our accomplishments, which I always love to do. However, we wanted to try something a little bit different this year, and we did a PDF of the annual report, which is available on our website and also available for download on our website. But I'll just go over a few of my favorite highlights. So the first program highlight that I want to share is that we had 90 referrals this year and averaged about 50 sessions a month. I believe last year we were at about 45 clients served. So there were quite a few more clients served, in part due to our donations and in other part due to the King County grant. So we hope to be able to continue this kind of work, this very much needed work, especially at this time. And the second highlight that I would like to go over is the financial impact of our collective work together, because there's a lot of different things that we were working on, not just services for clients, but also services for our providers who are in need of community, who are in need of training, and also in need of cutting the red tape or the yellow tape that prevents them from being able to stay in the field of mental health, either through community mental health services or independently in private practices. So we have saved $360 annually for each provider's listing. $3,000 in directory and marketing fees, $2,400 in PLLC cohort training fees, $3,165 in legal and marketing fees for the PLLC scholarship awardees who went on to launch their private practices this year, and $1,845 in approved supervisor training fees. Now, again, you can read more of this in our annual report, and the wonderful Maria Guzman was the one who put this together for us, and it's in our website. So if you go to dmhsus.org/about-us, you scroll down to the annual update 2023-2024, you can go ahead and click on download, or you can even kind of use the scroll bar to read through it. We want to say big thank you to everybody who donated and also those who approved grants for us this year. We have accomplished so much. We have so many more things that we would like to do. We really want to expand on our free therapy and wellness service. We're wanting to expand trainings for up and coming providers, and then also different kinds of supports like support groups or consultation groups going into the next year. So there's a lot that we want to do. We hope we're able to accomplish it, but we wanted to pause and just say thank you to everybody. How can you help us? You can go to secure.givelively.org/donate/deconstructing-the-mental-health-system-inc. Or you can scan this QR code in the top right corner. We're also always wanting to recruit more therapists for our listing, because the more therapists that are listed, the more access people have in finding us and finding our directory, and then finding the much needed services that they need. And you can add us to your resource list. So if you provide health services, but not mental health services, we may be a great resource to add to your resource list or get help page if you have one. And if you are a mental health service, please contact us. We would love to do an exchange of sharing information on our site as well. And you can follow us on a number of different pages, but if you go to Linktree, linktr.ee/DMHS, you'll find all of our social media, including LinkedIn, Instagram, TikTok, as well as current services and trainings that we have going on. And with that said, that is the conclusion of our annual report. And as you can see, we have our little one right here. I'm super excited to be a mom and just as excited to continue this work. This work is nothing without people who understand how crucial it is to not only call out the disparities, but address them in a way that includes communities who understand personally and directly how they have been impacted by things like racial trauma, economic disparities, educational disparities, health disparities, and so on. So we're going to continue this work, and I think first I'm going to go take a nap. So I'm wishing you happy holidays and a happy new year. Thank you so much for taking time to watch this video, and we will see you next year.